Hello and thank you for joining me. My name's Paige and I'll be taking you through a full body roll and release program broken into 3 parts. So in part 1 we're doing this video will be foam rolling lower body down. Part 2 will be foam rolling our upper body, and part 3 I'll be showing you my favorite trigger ball techniques. We can get into the little corners of our body that the foam roller can't. Now before we get started, I want to quickly chat about, there's a little bit of controversy out there regarding these amazing tools. I've seen videos on TikTok saying that these don't work. Now I disagree. I've been a massage therapist since 2015. I now teach massage and the philosophies and theories behind the therapy, and I can tell you now that massage and foam rolling and trigger balling have the same effect as a massage. Yes, I know therapists can go deeper and get into the muscle, but these tools are amazing for muscle recovery and also warming up before exercise. Yes, I also understand that there's not that much research out there. Why? Because we would have to get identical subject matter to conduct the research on. Everyone's different, everyone has different genetic makeup, physiology, so it's almost impossible. We would need 50 identical people all doing the same training, all eating the same, all sleeping the same, and then going through a foam rolling and trigger balling protocol. It's a little bit tricky. But the research that is out there tells us this, that using a foam roller is going to decrease the thick, tight muscle tissue that also sits higher than normal, and this is going to create restriction through our range of motion through our joints, therefore decreasing mobility. Foam rolling is also going to increase the blood flow, so going to get rid of toxins, and then also promoting fresh new blood, new oxygenated blood to our muscles, therefore a faster recovery and decreasing the muscle pain that we go through. It's also going to increase the temperature in our muscles, so it's great for warming up before exercise. Foam rolling is also going to break up those adhesions that are through the muscle band so we can lengthen and restore functionality. We're also going to improve the efficiency of the neuromuscular facilitation, which is the connection in the pathway between our muscle fibers and our nervous system. So that means we're going to have a smoother pathway ready for muscle contraction. Foam rolling is also going to decrease our chance of spasms and cramps within the muscle because we're really relaxing it. So let's get started. I'm going to show you an easy 5-step method that's going to help you remember how to roll out each muscle group efficiently. So I'll dive into that in just a moment, but let's just remember: roll, rock, melt, repeat, and then roll, rock, melt, repeat. And then once we've done the tight spots through that muscle group, we're going to just roll out and smooth it out again. And then if we're feeling a bit more advanced, we'll add some movement into it. Okay, so I'll just show you on my quad quickly before I get down and go further. So to start with, what you want to do is roll out the quad. So we're scanning now, we're trying to find those tight spots along those muscle bands and really take note of where they might be. Then we're going to rock. So we're going to rock from side to side, or we can either rock just lengthways, about 1 centimeter or 2 up and down, or when we're rocking side to side, we're breaking up adhesions in those muscle bands. We call this cross fiber friction in massage therapy. Now we want to hold and melt on top of the roller. So if I was face down, I'd be stopping and really melting into that roller and relaxing. Then what we want to do is repeat that, but on the next tight spot that's further down towards the joint. So we just want to roll a little bit, rock from side to side, stop, melt, and then repeat. And then once we've done, we can just roll the whole way out. So we want to smooth over now, getting that blood flow going. And then if you're feeling a bit more advanced, we'll add some movement into it, and I'll show you that in a moment. So we're going to start down on our gastroc area, our calf. What we're going to do is we're going to start near the Achilles tendon. We want to use our hands and bring our glutes off the mat and just roll and scan the whole way along the muscle. I'm just finding where these little tight spots are. Okay, there's one. I'll remember to come back to that. Not too many on the outside of my gastroc. Now to get the outside of your gastroc calf, point the toes out, and then we'll point the toes in to get that medial gastroc band. Okay, so now we want to, so we've just rolled, rock. So I'm going to rock from side to side. I'm on that medial band here, or up and down lengthways. Rock, rock, rock. So I'm breaking up those adhesions here. And I want to melt and stop. If you need a little bit more pressure over the top, just bring your leg on top of that one. And that feels good. Hold for about 15 seconds or so. Really try to relax that muscle. Really melt into the roller. Breathe. Surrender. I'm going to go over to the outside of my calf now because I found there was a spot, I think just about here. Roll, rock, breaking up those adhesions. Might need some more pressure on top of this. Stop, melt. And then move on to the next spot. So we go closer down to the Achilles here. I can feel when there's a spot right there. Stop, rock, and really melt into the roller. If you have any more tight spots, just keep exploring, try and search around for those. But now what I'm going to do is to try and stretch out that fascia like I was mentioning before with the movements. What we're going to do is start down to the Achilles, and as we're coming closer to the knee, we're going to lift our toes as we're stretching that fascia, which is that skin around our muscles. So if our fascia is really, really tight, it's not going to let our muscles release properly. So we're down at the heel, pulling our toes back towards our head and release. Back towards our head and release. Point the toes out and point the toes in. Okay, so now we're just smoothing over. And we're going to go on to the next leg now. So we'll do the exact same thing. You can roll out both at the same time if you like, just as a transition, and bringing that leg down. So we're going to roll the entire calf. We're going to point the toes in, point the toes out, and really search and explore for those tight spots. So I think I found one here. So we've rolled, we're going to rocking now, rocking lengthways, rocking widthways, cross fiber friction, breaking up those adhesions. Stop, melt, surrender, release, breathe. And then repeat. Let's find another spot now. So I think on my lateral gastroc head I found one. There it is. Stop. We're gonna rock. Ooh, this one's a bit tight. And then melt. Breathe. Alrighty, you can move on to another tight spot if you like. I think that was it for my gastroc, feeling okay. So now we're gonna add some movement into it here. So starting down at the heel, bringing our toes up towards our head and release. Stretching out that fascia, release, stretch. And you want to do your stretch at the same speed as you're rolling here. You don't want to be rolling too fast and then stretching at the end. Try to roll out and pull the toes back at the same speed. Okay, so we've smoothed over both calves now. So let's move up to our hamstrings. What I like to do to start with, I like to roll out both at the same time so I can see also what side I need to spend a little bit more time on. Okay, so let's just start on the right. You can always put your leg down for support. Remembering to turn on your core as well as we're doing this. We want to have our support system nice and strong. So we're rolling, we're searching, exploring for those tight spots. So I feel like there's one there on the medial side of my hamstring. Same thing, bringing your knee in towards the midline of the body to hit that inside hamstring. Okay, so there's one there. Let's just rock from side to side, breaking up those adhesions again. Stop, melt. Now I need a little bit more pressure on top, so the leg on top as well, like we did on the calf. And then repeat. So let's move on to another area. I'm going to go a little bit closer to my pelvis now. I can find another tight spot here. So we're just going to roll, rock. I'm just going to rock from side to side. Okay, stop, melt. Breathing through that one, it's a little bit tight. Okay, then we're going to move to the next spot. There might be one on your lateral hamstring here. So let's try and find that one. A little bit closer to the knee. Now your tight spots might be in a different area to mine, and that's okay. You just head to where those tight spots are. Okay, rocking from side to side. Melting. And then let's just roll out the whole leg. It's a little bit harder to add movement into our hamstrings. But what we can do is just slowly even flex the whole leg as we're going up and bend the knee just slightly. Extending the foot up and bending just slightly. Okay, so rolling that one out, smoothing over those tight spots. Let's move over to the other hamstring. Searching around, let's find where those little tight trigger points are, those tight knots. And there we go, let's stop, rock, cross fiber friction, let's break up those adhesions. Melt. And continue to roll. Let's go onto that lateral band now. Stop. Rock. Melt. And continue on to roll. Okay, we can even add just a little tiny bit of movement into here. We can't get full knee flexion. We can see how we can go. And then we want to roll from the knee up to the hip, extending that foot and coming back down. I don't know if you can see it too well here. And coming back down. Even lean forward a little bit more. That's going to create a stretch through your hamstring too. Okay, we're going to go into the glutes now. Let's move on to that area, search around, let's find a little tight spot. Okay, so there's one there. Stop. Let's rock. We can even bring the ankle up over to the knee just to put that glute on stretch a little bit more. That's going to better our release. I find releasing the glutes, we're going to do a little bit better job with our trigger ball, which I'll show you in the third part. Rocking and melting. You can see I've brought my heel off the mat, just trying to bring a little bit more body weight on top of that roller here. And then we're just going to roll out the glute. Okay, there might be a tighter spot down just on the bottom where our sit bone is. So let's roll over the top of that there. Knee up the top, over the knee. And rolling out. Okay, let's move it to the other side. So let's explore around, find where those tight spots are. Okay, there's one there, stop. Rock from side to side. Melt. If you need to, just lean back a little bit more, making sure your core is turned on though. We want to support that back. Rocking from side to side. I'm using a bottom support leg here to help me rock from side to side. Okay, stop, melt. Move on to the next spot. Okay, ooh, there's one there. Rocking, stop, melt. Really surrender, breathe, melt on top of that roller. Okay. Moving on. We'll move on to the TFL here. So I'll just spin around and do it on this left side. We'll cover the glutes a little bit more when we get into our trigger ball release, because we can get into all the nooks and corners with those balls, because this foam roller is a little bit too much surface area to really get into those spots that we need to. Okay, so we're on the side of our glutes. Now what we're going to do is target the TFL, which is the tensor fascia latae, and that's the one that also connects down into our ITB. So if these ones are tight, can also put pressure all the way down into the ITB, into our knees. Sometimes our glutes aren't firing or doing the right job, so the TFL is going to take over as a stabilizer. So if that gets a little bit sore, we're going to roll onto the side here. So normally that TFL, we find our hip bone just here. It's just below that and to the back, just a little bit here. So you'll feel it, it's quite tender. So we want to find the spot there, and we just want to roll up and down. I'm even trying to relax the bottom leg there. Really find it. Now we might need to rock forward and back here to find that spot. Okay, there it is. Now I can just roll on top of it quickly. Making sure we're not also sinking into the shoulder here. We want to create a nice support system, so 90 degrees and 90 degrees. We don't want to be putting pressure on these joints here. Rocking from side to side, breaking up those adhesions. And then, oof, I think I need to go a little bit more. Okay, stop. Let's melt. Really release this bottom leg. Breathe through this one. We're also going to get the trigger ball into that in part 3 as well. So if this doesn't target it as much as what you need, the trigger ball will. Okay, so let's roll that one back out. Now because the TFL is quite a sore muscle, we probably will only find one spot. Okay, so from here, let's roll down our ITB, everyone's favorite. Okay, so we're gonna stop up, start up on the top of that hip bone on that hip joint here. Okay, try not to go over the head of the femur, it hurts too much and we don't want to aggravate that joint capsule. So we're just starting below. Now what we're going to do is, if you can break it into two parts. It is quite a long muscle, so you can break it into two parts here. Or if you're feeling more adventurous, let's go the whole way along. So this is the whole way along here. Or if you just wanted to scan, just start on this top part and then go down to that lower part here. Okay, I know where those tight spots are. So let's find one here. All right, stop. Now we're going to rock, breaking up those adhesions. Really breathe through this one. And melt. Whew, this one's tight. Okay, we're going to repeat, move to the next one. We're going to get closer to the knee now. Rocking and melting. Really surrender into that roller. Breathe. Foam rolling's great in that you are the one that's going to control how much pain you're in. So if you need to take a little bit more of your body weight off just to start with, bring that knee closer and just prop yourself off the foam roller just so slightly until your ITB is warmed up enough. And then you can go deeper and deeper gradually. Okay, down towards the knee, you'll probably have one last spot down here. Okay, there it is. Rocking. Okay, so let's do the entirety of the ITB now. And if you want to add in some movement, what we're going to do, start the foam roller down at the knee, and as we're rolling, we're going to lift up that back foot and down. Lift up and down, lift up as down, the same speed as what we're doing on the roller as to what we're lifting up our leg. Okay, so let's move on to the next side now. So getting into that TFL. Up and down. Find that tight spot, explore around, stop, melt. Add your rocking in. Okay, and then continuing on down the ITB. Rolling out the entirety, exploring. Okay, let's find those tight spots. So there we go, there's one. Stop, melt. And we're rocking, melting, breathing. Take a little bit more pressure off if it's too much. Bringing that hand in a little bit closer, that foot closer. Moving on to the next spot. Oof, there it is. Rocking, melting. Moving on to the next spot. If you like, you can hold on to these tight spots for a little bit longer, go up to 30 seconds or up to a minute if it's really, really tight and really, really reactive. It's up to you. If you're a beginner, I suggest just easing into it. Don't go too hard too soon. You don't want to cause any bruising as well, so let's ease our body into it. And that's why it's good to try and warm up that muscle first. With your foam roller, this one's actually a little bit harder. You can get softer ones, so I suggest if you've never done rolling before, find a foam roller that's a little bit softer. If you're advanced, I've seen some people use some plumbing pipe or even just round bits of concrete that someone's created. But your body will get used to it the more that you do it. It's like muscle memory, you're building up your tolerance. You go to the gym, you're building muscle. The more you foam roll, the more you're going to get used to it. Okay, so let's move on to our quads now. Going to roll over. And we want to just get the body on top of that roller here. We want to start up at that hip joint. And we want to start up at the hip joint and try and roll the whole quad out because we're doing some exploring again. Okay, so I feel there's some through my rectus femoris, which is that muscle band in the middle. Then just twisting our body over just slightly onto the roller to try and feel, we're not on the ITB here, we're on our vastus lateralis, which is the quad that's on the outside of our group of quads. Okay, so there's one there. Stop, rock, and melt. Finding another spot now. So we go closer to the knee, stop, rock. This one hurts. Melt. I think there's going to be one up closer to my hip bone. Yeah, there it is. Stop, rock, melt, and continue to rock. Okay, next spot. So I'm just going to find one more. Maybe let's go closer to the knee, on the inside of that knee. And what I'm doing too, if you can see my back foot, I'm using my toes to move myself forward and back. And I'm also just slightly using my upper body too. This is going to make it easier on my upper body if I'm using my toes. Turning on that core as well, I feel like I'm in a bit of a plank position here. Okay, stop, rocking, melting, breathing. Okay, then we want to roll the muscle out in its entirety. And then we're going to add movement. So what we're going to do is, here at that knee joint, the same as what we did down on that gastroc, we're going to roll down and bringing that heel closer to our glutes and coming back. So I'm almost doing a bit of an army crawl, a commando crawl. So starting at the knee, crawling back and crawling forward. I've got the other knee and foot planted on the mat for support, and we're going to roll back again and up. This one's nice. And then we can also do at the end, if you feel like it, add in a quad stretch. Hold for about 15-20 seconds. And then we're going to move on to the adductors now, which are towards the midline of our quads. We also have to rotate our body towards the roller to try and hit our adductors. So here we are here. I'm always got a bent knee. Rolling it in its entirety. Let's search, let's look around. Our adductors are going to be pretty sore. I find it's quite common whenever I give someone a massage, their adductors feel like they're bruised or they're on fire. If our glutes aren't firing properly and they're not doing the work they're meant to be doing, they're not stabilizing correctly, so our adductors are going to take the brunt of the force that's going through our legs. So if that's the case and it's happening a lot, rolling out your adductors are great, but also we want to learn how to fire our glutes properly, and I'm sure you're going to find this in other videos on our app. Okay, so here we are here. Oof, that's a tight spot. Stop. It's a little bit harder to rock here in this position, but just do the best you can. Okay, and hold, melt, breathe. Go to the next spot. Try and go up as high as you can, up towards that pubic bone. Okay, stop, hold, melt, rock, melt. Now, if any time you do need a bit of a break, because it is a lot on your upper body, just take a short break, have a little sip of water in between, and get back on and start going again. Okay, so I'm going to roll out in its entirety. I find the adductors are one of the hardest muscles to roll. I feel like I'm struggling a little bit, so don't worry about if you're struggling or you're starting to shake or you're getting puffed. Okay, let's go on to the other side now. Quad. Okay. So you really want to bend this knee, put pressure on that toe. And we're using our quad on this side to push us forward, just so our upper body doesn't have to do all the work. Okay, so there's a tight spot there near my hip. Stop, rock, and melt. On to the next one. Oh, ooh, there it is, stop. Ow, rock. Melt, whew, breathe, relax that bottom leg. I just found that I wasn't relaxing my bottom leg. So relax, surrender, melt, breathe. Okay, into the next one. Now you're most welcome to spend more time. If you want to be a bit more thorough, if you're really, really sore, you will need more time than what I'm showing you. Okay, here we go, stop. Rock and melt. Relax that bottom leg. Turning on that core, pushing through that shoulder, no sinking, pushing out. Okay, let's move on. Let's go closer to the knee now. Okay, stop, rock, melt, breathe, and moving on. Okay, so let's add some movement into this one here. So starting down at the knee. Just straighten that one up a little bit. Starting down at the knee, and we're going to army crawl down, straighten the leg. Army crawl down, bend the leg, bringing the heel to the glutes, coming back up. Turning that core on. Okay, once more, then we can add a quad stretching if you like. Breathing. Stabilizing with his foot and with his knee as well. 15 to 20 seconds. Now let's go on to the adductors really quick. This will be our last one, and then we'll jump into part 2. Okay, stop, rock, oh this one's tighter, and melt. Breathe, surrender, bring that hip down if you need to. I had a little bit too much pressure on top, I was in a little bit too much pain I think. Okay, rocking. Repeat, let's go down further. Ooh. Okay, stop, rock. Cross fiber friction, let's break up those adhesions. I feel like there's a few adhesions in this one here. And melt. Okay, entirety. Okay, so that was the last little exercise of our lower body foam rolling program. In our next video now, I'm going to show you our upper body. So meet me over there and I'll see you soon.